Hello, welcome to Nursing with Professor B. My name is Brigitte. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I will be going over Maslow's hierarchy of needs and how to use it when you're answering NCLEX style nursing questions that ask you, for example, what's the priority or what's the best option? All right, but before we get started, make sure you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. Let's go. So using Maslow's hierarchy of needs in order to answer NCLEX style questions. A little bit about Maslow. Maslow was a psychologist that developed this theory that human beings have basic needs that must be met first before they can move up this ladder and reach the other levels. So for example, before I'm worried about love and belonging, creating friendships, I need to make sure that I can breathe, right? Imagine if the option is between having a friend or being able to take a breath of air. The priority is breathing, right? So that's the principle of this hierarchy is these are the basic needs that must be met, and then we can move up. In real life, it doesn't follow this neat little path. Sometimes people can fluctuate and go back and forth in between these rungs. But in nursing, for exams, you would follow this order. Rarely are you really answering any questions at the self-actualization phase, in nursing school at least. The other thing that I wanted to point out is that under physiological needs, think of your ABCs: airway, breathing, circulation. Now, under ACLS, it is now CAB, circulation, airway, breathing. But for nursing, airway is still king, okay? So airway takes precedence even over breathing. The reason why this is because if you don't have a patent airway, but you can breathe, let's say I have an obstruction in my trachea, how am I going to get that breath in if there's an obstruction? So airway is king. And then, so airway, breathing, circulation, these are at the most physiological level. So air, water, food, shelter, sleep, clothing, reproduction. Safety needs, a lot of times in mental health, this is the area where we are answering questions. Safety is priority in mental health nursing. And then we move up to love and belonging, esteem, and self-actualization. Again, under physiological needs, when you're in nursing school, things that count as physiological is oxygen, fluids, nutrition, body, temperature, elimination, shelter, and reproduction. I don't want to get flagged by YouTube, so that's why I'm saying reproduction. Remember though, even though these are all part of the same rung, they are not equally important. So oxygen would take priority, or airway takes priority over nutrition. So use common sense. Same thing, airway takes priority over reproduction. Use common sense. Think about it. If you are dying and you have the option between eating food or taking a breath of air, you're going to want to take a breath of air. Now, safety and security includes physical safety and psychological safety. Again, in mental health, psychological safety a lot of times is assessed because we are afraid that people that are having suicidal ideation may actively act upon their thoughts and they may harm themselves. So if you see a nursing question that talks about first, best, or priority, consider using Maslow's hierarchy of needs, because it's asking, you have to prioritize what's the best, what's the most important. And this is what's frustrating in NCLEX world, because sometimes you feel like all four are right. Sometimes you feel like you could do more than one at the same time, but you have to pick the first, the best, the priority. A patient is brought to the ED due to anaphylaxis. What is the ED nurse's priority? Question mark. Anaphylaxis is closing up of the airway. Monitor the patient's level of consciousness, protect the patient's airway, provide psychosocial support, administer medications as ordered. So based on Maslow's hierarchy of needs, psychosocial support is not at the physiological level. So out of all of these options, which one is the priority? And it's protect the patient's airway. So that is the correct answer. Next, we have a nurse is planning the care of a patient with AIDS who is admitted to the unit with Pneumocystis pneumonia. This is a very common kind of pneumonia in someone that is immunosuppressed, like someone who has AIDS. Which nursing diagnosis has the highest priority for this patient? All right, again, ineffective airway clearance, impaired oral mucous membranes, imbalanced nutrition less than body requirements, activity intolerance. You're going to see all of these NANDAs. All of these NANDAs are appropriate for someone with AIDS. They will sometimes have impaired oral mucous membranes, or they will lose a lot of weight and they will not be able to eat. So, but what takes the priority? And once again, it's the ineffective airway clearance. A patient who just suffered a suspected ischemic stroke is brought to the ED by ambulance. On what should the nurse's primary assessment focus? Someone just had a stroke. Again, all of these are appropriate answers. But are we worried about cardiac and respiratory status, seizure activity, pain, fluid, and electrolyte balance? Now remember that under physiological, fluid and electrolyte is there also, but airway is king, okay? Airway is king. Airway is king. Airway is king. Airway is king. All right, so maybe that'll help you remember. Cardiac and respiratory status, again, is what we are worried about. ABCs. Think ABCs before you go on to other things under physiological. A homeless person is admitted during a blizzard with complaints of being unable to feel his feet and lower legs. Core temperature is noted at 91.8 degrees Fahrenheit. The patient is intoxicated with alcohol at the time of admission and is visibly malnourished. What is the triage nurse's priority in the care of this patient? Addressing the patient's hypothermia, addressing the patient's frostbite in his lower extremities, addressing the patient's alcohol intoxication, addressing the patient's malnutrition. So again, what is the priority? Which one, when you're answering these questions and you're at the physiological level, which one can kill you? Life over limb, they like to say. So in this case, the correct answer is addressing the patient's hypothermia, because frostbite can be very dangerous and it can lead to amputation of that extremity or those fingers or those toes. Will that kill you? Not always. Can you die from hypothermia? Yes, this is a very real concern. The body can shut down. So we need to take care of this first, and then we can go on to the other things. The rationale for this question: the patient may have frostbite, but hypothermia takes precedence because it is systemic rather than localized. The alcohol abuse and the alteration in nutrition do not take precedence over the treatment of hypothermia because both problems are a less acute threat to the patient's survival. So once again, hypothermia, very real threat, very serious. And then the other things could be tackled once the hypothermia is reversed. All right, if you want more videos like this, leave a comment below. If you want a free copy of this PowerPoint, then make sure you email nursingwithprofessorb@gmail.com. I will put my email address below, and send me a screenshot that you've liked and subscribed to my channel. All right, good luck. Until next time.